St John Ambulance have now delivered over 1 million patient-facing hours in support of the NHS to help get us through to the other side of the COVID-19 pandemic. The last year and a half hasn't been without its challenges. I was volunteering with my crewmate as part of an emergency ambulance crew supporting the London Ambulance Service, and we were driving in West London when we were tasked to a gentleman who was collapsed on the pavement. He was in cardiac arrest. So this meant that when we arrived there was a gentleman lying on the floor who was unconscious and he wasn't breathing. So at that point we began resuscitation and we worked as a team to successfully resuscitate him and transport him to hospital. We've all had our own personal challenges, and us as volunteers have had to step up and been able to do what we're trained to do to help support the NHS throughout the challenging few months that we've been facing.
Since March 2020, Zane and other volunteers have given 590,000 hours to the vaccination programme, 152,000 hours in emergency ambulances and 136,000 hours in hospitals.
It's about being there to help others. Ultimately, that's why we're all here. Whether that is just helping out nurses in hospitals by taking some of the weight off their shoulders and helping to feed patients, or whether that's getting so many more people vaccinated ready so that we can, get people seeing their families and friends again.
We would be going that way.
I'm in East London, based in East London, and doing the vaccination project, we've helped local communities hopefully get back to a sense of normality. It's been challenging. In the first few months I was stationed at the Nightingale in East London, where we were just helping, swabbing. You basically do anything that you can just to help out where it is needed.
St John Ambulance also distributed 500,000 items of PPE throughout the pandemic.
We're there to help support people, and London especially needs it given how busy it can get, whether that's at events or whether that's at vaccination centres, whatever it is. We're always there to provide that little extra boost to people that you need, that you didn't know you needed until we're there.
We're now better embedded into working alongside and as part of the NHS, and this will continue. Our volunteers want to continue doing this, and I think the country's realised that we can bring a lot of good to the country by doing this.
Jem O'Reilly, BBC London.